Hello everyone. Now we will move to another slide of our asthma types. So what are the types of asthma? First extrinsic and second one is intrinsic. What is the meaning of extrinsic? We'll see now. This type is initiated by a type 1 hypersensitivity, which is considered as your atopic response to an extrinsic antigen. As we all know that there is obstruction or swelling, or you can say inflammation to your airways which are present in your lungs, get infected by the antigen or the uh, by the foreign particles, which are considered as your extrinsic. Now second one is intrinsic factor. This type is initiated by non-immune mechanism such as respiratory tract infections, exercise, aspirin, emotional upsets, and exposure to bronchial irritants, which you can consider as your cigarette smoking. So now we can differentiate between these two as a extrinsic, which are the external particles which causes inflammation to your airways of your lungs, and intrinsic factor uh, which are due to internal infection, which is caused by your exercise, aspirin as your drug infection, emotional upset, which is your emotional condition, and exposure to bronchial irritants, that is your cigarette smoking, excessive cigarette smoking, which goes to your lungs or your airways and block the pathway or cause the inflammation to your airways. Now it will reclassify into further four types. First is atopic asthma. As we all know that this is extrinsic factor. This asthma is of type 1 Ig mediated hypersensitivity reaction, and it is a very commonly occurring type which more often begins in childhood. It begins in a childhood. The attack of atopic asthma may result due to allergens in dust, pollen, animal dander, food, or infection. As we all know that this is extrinsic or external particles, external antigen which are going into your airways and which causes your IgE mediated hypersensitivity. Those are your dust, pollen, animal dander, food, or any type of infection. Now these attacks are characterized by allergic rhinitis, urticaria, or eczema. Now how can you diagnose all these things? How can you diagnose the allergen which is going into your airways of your lungs? So we have that test which is called as radio allergosorbent test, that is RASTs, which determine the presence of IgEs which recognize specific allergen. Whichever allergen is going from external, you can identify or determine which type of allergen it is by this test. Now we'll move to second, non-atopic asthma. Now this asthmatic patient do not show allergen sensitization, and the skin tests for diagnosis are negative. They show you the negative test or the allergen sensitization may or may not they show. Non-atopic asthma is caused by viral respiratory infection, for example rhinovirus and parainfluenza virus, and inhaled air pollutants, for example sulfur oxide or ozone or nitrogen oxide. And since humoral and cellular mediator, which is eosinophil, that is the granulocytes of your WBC. So basically the difference in between these two, atopic asthma is of external or extrinsic factor, and in non-atopic asthma it may show or may not show any allergen sensitization or any test, skin test it will give you positive. um, it will show you rather negative test. uh, it is caused due to viral respiratory infection. So what are the viral infections? First one is your rhinovirus or parainfluenza virus, or you can consider as your inhaled air pollutants, which are your sulfur dioxide, ozone, and nitrogen oxide, which causes this non-atopic asthma. Now we'll move forward for the third type, which is drug induced asthma. Now in this asthma, it is caused by certain pharmacological agent, for example aspirin. So drug which induce asthma are the condition certain drug have some mechanism of pharmacological activity which shows the asthmatic effect to that particular person. In that, first one is your aspirin, and the second one is your NSAID, non-steroidal anti-inflammatory drugs. The aspirin sensitive patients show periodic rhinitis, nasal polyps, urticaria, and bronchospasm. Bronchospasm, yeah. Now, fourth one is your occupational asthma. This type of asthma is caused by fumes, epoxy, resins, and plastics, or organic and chemical dust, which are wood, cotton, and platinum, and other chemicals. The patient gets asthma attacks on repeated exposure to the antigen. Now, as the name it suggests, occupational asthma means those who are engaged in a particular work which consider or which have some fumes in their profession, or you can say organic or chemical dust in or under another chemicals, so they get infected due to these chemicals, and they get asthmatic attacks on the repeated exposure to the antigens. Thank you.